Argentina has tightened pandemic lockdown measures again this weekend. People may be out near their homes during the day, but no gatherings are permitted. Shops must remain closed, and next week there will be no classes for students or sporting events. The government announced the second strict lockdown on Thursday. Only about 5% of the population has been fully vaccinated.
Soy muy consciente, plenamente consciente.
I am very conscious, fully aware that these restrictions cause difficulties. In this reality, there is no choice but to choose the preservation of life. I am not going to accept the normalization of this number of infections or deaths.
These restrictions are in place until May the 30th, but also include the following weekend, the 5th and 6th of June, as the government seeks to reduce the dramatic increase in the number of infections.
In this country of around 45 million, the number of daily infections was just over 5,000 back in March. Friday alone saw more than 35,000 new confirmed cases. Only India and Brazil registered more. Many hospitals are reporting they are close to collapse. At least 73,000 people have died from COVID-19 so far.
The current situation in Argentina is very worrying and serious. It is the worst moment in the pandemic. We have a second wave, which is 70% worse than the first.
While Argentina waits for more vaccines to arrive, the government is in discussions to produce the Sputnik V, AstraZeneca and Sinopharm vaccines locally as the Southern Hemisphere winter sets in.
The present is worrying, but the future is more encouraging because Argentina has technical capacity and infrastructure to produce its own vaccines. So with the transfer of technology, this can happen.
The 2020 lockdown devastated many sectors of Argentina's economy. With an extended public holiday next week, the government argues only 3 working days are lost with these restrictions. But the likelihood is further restrictions will be required over the coming weeks, if not months. Joel Richards for CGTN in Buenos Aires.